You're watching BBC News now. Let's get more on the government's announcement that thousands of extra mental health workers are to be recruited by the NHS in England. The government aims to treat an extra 1 million people by the year 2021. Well, the Health Secretary, Jeremy Hunt, told the BBC it was time to end the historic imbalance between mental and physical health services in England.
We are confident that we can get these numbers. There are people who are trained in mental health nursing, people who are trained as psychiatrists who are not currently working in the NHS, and we have a programme to attract them back into the NHS. And what we want to say to them is that we probably have the biggest expansion in mental health provision in Europe going on at the moment. We're proud of what we're doing, but we want to do a lot more.
That was Jeremy Hunt. Well, with me now is Hope Virgo, who was diagnosed with anorexia at the age of 16 and suffered from a shortage of mental health nurses. Let's just explain. You went into hospital at the age of 16.
Yes, that's right.
Very ill.
Yeah, so my heart nearly stopped when I was 16, and so I got admitted then, kind of had no choice about it, having been ill for the 4 previous years in the run-up to that.
So looking at those 4 years beforehand, why did it get to the stage where you ended up in hospital?
I don't think anyone understood a lot about anorexia, probably. That's kind of my excuse. I don't think anyone realised how extreme it was. And I think a lot of the time with eating disorders, people see it as a phase that someone's going through and that they don't take it as seriously as they should take it.
So a mental health nurse, I mean, all these terms, mental health staff, individual people who can make such a difference to a patient like you. How? What is it that they do? How much time do they need to spend with you?
A lot. So in one way, I guess I was lucky that I spent a year living in hospital because I had fantastic one-to-one support at that time. They kind of retaught me how to eat. I had cooking lessons with them. I went running with one of the nurses because I do a lot of running, and it was about kind of making me understand how to exercise in a healthy way. I had group therapy sessions, like everything. And through that, it took a year of intensive therapy for me to then realise that actually something was the matter and to equip me to then manage my recovery for the rest of my life.
And yet, at the age of 18, you leave hospital, and it doesn't take much, a trigger, whatever, and you're back in trouble. But what happened in the intervening period? What went wrong with the care that you should have been receiving?
I didn't get it. So when I was discharged at 18, I was supposed to have outpatient support. When I went to university, I didn't get anything. And they kept trying to put me on antidepressants when I left when I left hospital. And I wasn't depressed, I just still had
issues. This is the university that did this?
No, the hospital that was linked to the university. Right. But I just was still struggling a bit with food. And then I managed it for the kind of 8, 9 years. And then last year, it kind of hit rock bottom again. And my grandma died. And after that, I struggled so much with guilt. And it was just awful. And I ended up trying to readmit myself to the mental health hospital because I knew that I was getting unwell again. And I knew that I didn't want to get unwell. And so I had this constant battle going on in my head. But then you reach out for help and get told that you don't hit the criteria because you're not underweight enough. So they can't offer you any support.
Very, very briefly, Hope, in terms of the promise of 1,200 more staff, I mean, it sounds good. We've heard about this imbalance between physical and mental health before. Do you think the message is getting through?
I think it's improving. I think people are gradually beginning to talk about mental health more, which is definitely helping. But I don't think this is enough. I think this is a sticking plaster. I think people keep saying they're going to do things, and actually everything needs revamping. They need to think about things like prevention, early intervention, everything, and not just say they're going to do this unless they're 100% going to follow through with it. Well,
I know you tour schools, you tour other organisations and talk about prevention, so it's good of you to come in and talk. You've got a book coming out as well, is that right?
Yeah, so it came out in March, actually, yeah.
Well, it's good to talk to you.
Fab.
Thank you very much.
Thank you.
Hope Virgo, thank you.